Granny Nannies is a licensed nurse registry. We have been in the state of Florida since 1990. There currently are, I believe, 18 locations throughout the state of Florida. Each one is individually owned and operated. We specialize in CNA, which is Certified Nursing Assistants, and HHA, which is Home Health Aide level of care, for individuals, couples, or, maybe an individual with a special care need. There it goes.
Do you take care of special needs, people with special needs or special disabilities?
Absolutely. For the elderly, you have some who are experiencing varying levels of dementia and Alzheimer's, as well as Parkinson's. And our caregivers are trained to deal with the elderly in all of those capacities. We also look after children that are of special need.
Okay. So there's really not an age limit on your facility, your agency's care?
We are primarily for the elderly. However, having said that, sometimes there is a parent that needs a bit of assistance with a child that may have a special need, and so we will go in and assist them as well.
Okay. How do I know if a granny nanny can help in my situation?
Well, generally for the elderly, I'm assuming that we're looking
for mom.
For mom. Okay. You will probably begin to see changes. It may very well be that you're noticing that she's starting to forget a bit, or having difficulty getting around on her own. Sometimes it may be poor grooming. You may begin to notice that maybe she's not showering as often. Those are little red flags, I guess, would be the best way to put it.
Should I be watching for nutrition? Like maybe she's not eating right?
Absolutely. Absolutely. Yes. For some, it may be like a loss of interest in activities. You may begin to notice that she's becoming more of a homebody as opposed to wanting to get out and about.
Instead of being the social butterfly.
Yeah.
She doesn't like to go out.
Mm-hmm.
And how do I know when it's time that I should start getting help from mom?
Well, as we talked about a little bit, that there will be the signs.
Mm-hmm.
You begin to know that something just isn't what it used to be.
Right.
But then you may have gone to the doctor with her, and there may have been a diagnosis of a particular illness. And sometimes it may be something that's just, a chronic illness that's just preventing her from being able to do what we refer to as her activities of daily living. On the mental side of things, you may begin to notice that she's just a little more forgetful than maybe the last time that you saw her. Sometimes there's issues with medication. Maybe she's forgetting to take it all together, or it may be that she's not taking it properly.
Okay, which I have noticed. She's,
Mm-hmm.
Forgetting to take her medication.
Mm-hmm.
And is different mood swings, is that part of some of the signs I should look for? Like one minute she's fine, the next minute she's snippy.
If she's not normally snippy, one might think that, that probably would be, a sign that something is beginning to change in her. And it may simply be, it's not necessarily a diagnosis of a particular illness, but you're just beginning to notice that as she's getting older, she is starting to change and she's unable to assist, or she may need assistance with her activities of daily living. Um, and I don't know what your situation is, but if you work outside the home, it may very well be difficult for you to be able to assist her in all the areas that you think
Right.
that,
It's very overwhelming
yeah,
at times.
yes. And that's where an agency like ours steps in and is able to help, because while you may be the primary caregiver, or you are the primary caregiver, sometimes you need a little bit of a break as well. And, you know, when we say you need a little bit of a break, we say that with all due respect to you and to your mom. But what we want to make sure of, just like we do with our caregivers, is that you don't burn out.
Right. And become spiteful, or not spiteful, but just tired.
Yeah, yeah.
And what exactly do you offer as far as granny nannies?
It can be set up in a number of ways. The first thing that we like to make sure that our clients understand is that it is client-based. So you tell us what you need, and we work to fulfill that need as best we can. We offer everything from a couple of hours, a couple times a week, to 24-hour a day, 7-day a week care if that's what's needed. We also provide living caregivers, and that is where the caregiver will actually be in the home around the clock. And within that, then in terms of care, basic care is someone coming in to just assist with light meal preparation, light housekeeping, getting mom or dad to or from doctor's appointments, assisting with grocery shopping. And then from there, we move on to what we refer to as more hands-on or personal care. We have some clients who need assistance with their personal grooming, their bathing, their dressing. And then there are those who are unable to get out of bed on their own. So we assist with the transferring and the toileting as well.
Okay. Now, mom does not remember to take her medications and her insulin on time.
Mm-hmm.
Does your CNA remind her?
Absolutely. Absolutely. And that is built into the service. There is what we refer to as medication reminding. Sometimes it's just a little trigger to help them remember.
Okay. What else can you tell us about granny nannies? And how do you choose your caregivers?
As a nurse registry, the state of Florida sets out guidelines within which we have to follow. And in terms of our caregivers, all of our caregivers are either CNAs, as I said, or home health HHAs. We, I guess for lack of a better way of putting it, we pride ourselves on really taking the time to get to know our caregivers. Oftentimes agencies, when they conduct orientations, will hold it in a group setting or a classroom style setting. We want to get to know the people that we're sending into our clients' homes. So, we pride ourselves on taking the time to really get to know our caregivers. Our interviews and orientations are done one-on-one. Just as important as it is for us to get to know as much as we can about the client, it's really important that we get to know as much as we can about the caregiver, because we want to know who we're sending into that client's home.
And taking such a long time on the orientation interviews, does that help make a better fit so you can know their personalities?
Absolutely. Absolutely. I mean, what we generally will do is, once the decision has been made by the client or the family member that Granny Nannies is the agency that they would like to work with, we will schedule a time to come out to do an assessment. And that assessment serves a number of purposes. One, it is to make sure that we have a clear understanding of what the need is. But two, it also gives us an opportunity to get to know the client, what their likes, what their dislikes may be, what some of their interests may be. And we then take that information back to the office and we conference it amongst ourselves in the office and try to get the caregiver that we think is best suited for that particular client. Because whether you like it or not, whether it's 4 hours or you're having someone come in to stay around the clock, you're having a stranger come into your home. And we want to try to make that as smooth a transition as we possibly can.
You mentioned having a stranger come into our home.
Mm-hmm.
How do you know these people are safe to come into my home?
Well, once again, as a nurse registry in the state of Florida, the state requires that there are guidelines that are set. So we make sure that all of the people that are working with us, we check their criminal history background. We check their references. We check physicals. Yes. And, just really trying to make sure that we have a pretty good idea. Nothing is foolproof, but that we have a pretty good idea of.
And if my mom and the person you send in butt heads or don't get along or just for whatever reason don't like each other, am I stuck with that person?
Absolutely not. Absolutely not. We try, as I said, our very best to try to get the match right. Sometimes we don't, for varying reasons. And when you find that it's not a good fit, we ask that you give the office a call, and we keep working with you until we get what works for mom.
That's comforting to know.
Yeah.
And I've heard of private hiring people privately. What's the advantages or disadvantages of hiring an agency versus private?
For some people, there are advantages, but there are also disadvantages. Once again, when you're going with an agency, you have the agency that you are relying on. You know that the agency has done the necessary background checks and reference checks to try to find out as much as they can about that particular individual. With a private caregiver, you may not necessarily get that unless you were going to do it on your own.
Which can be very hard, am I correct?
It can be, and it's costly as well.
And what if I may ask, what is the cost? And if we don't have the funding for long term, what is the cost?
When you say you don't have the funding for long term.
Mom never planned for this.
Okay.
For
It really does vary depending upon what the need is, price wise. So it would be difficult to say exactly at this moment until after, we've gotten to know a bit more about what the care need is. But once again, I'd like to say that we do pride ourselves on being very affordable. What we do know is that quality care can be provided at an affordable cost. We've been doing it long enough to have figured that part out.
That's comforting to know. And is there any other services Granny Nannies provide that maybe I can pass on to a neighbor if they need help?
Mhm. Well, I mean, in addition to the elderly care, um, as I shared with you a little while ago, we do provide care for disabled children.
Mhm.
We also provide a service that is for new moms. Now, a lot of times people say, okay, well, you're looking after newborns. No, that's not it. We go in and assist the new mom with her daily housekeeping so that she and the family can bond with their newborn child.
That is very interesting.
Yeah.
Um, Now, I do have one question. Is it, do your nannies transport mom to the doctor's appointments if I need to?
Absolutely. Absolutely. And that can be done a couple of ways. We have some clients who have their own vehicle. They are just unable to drive for themselves, in which case the caregiver, if it's okay with the client, will use their vehicle. Um, and then if the client is without a vehicle, the caregiver has hers, which is insured, and she will take the client to and from. There is a third option as well. We have some clients that are wheelchair bound, and one of the issues for them is they're unable to get in and out of a standard automobile. Granny Nannies has a modified van, handicap van, for our wheelchair patients. And that van is used, when that client uses that vehicle, it is solely being used for that client. So they don't have to worry about getting into a coach where there's a number of other people and having to make a number of stops along the way. They have the van for whatever the period of time is that they require it. And it can be done in one of two ways. They can be taken to their appointment, dropped off. Driver will see to it that they get inside and that the doctor or whomever it is that they're going to see knows that they are there,
Mhm.
and will leave. And then when they're ready to be picked up, they'll make a phone call. We'll come back out to get them. Or we have some who feel comfortable having someone with them, or maybe uncertain as to whether or not they would remember all of the things that they're being told that they need to do. So in situations like that, a caregiver can stay with them, go into the appointment, take notes to help remind them what they were told they need to do and when their next appointment is.
So that information could be passed on to me, so I would
Absolutely,
remember.
if you are unable to be with her.
Okay.
Yes.
And so you provide care basically anytime we need it. Um, I've heard a lot about something called respite care. What is that?
I said something to you earlier about you being the primary caregiver and making sure that you don't burn out.
Yes, ma'am.
Respite care is so that you don't burn out. It is where a caregiver comes in and will look after your loved ones so that if you need to take a break for a couple of hours, or if you need to go away overnight or for the weekend, you can go away feeling confident that mom is being taken care of by someone who is trained to look after her.